In Good Shape, your weekly dose of health information on Deutsche Welle. Find out more about what's new in medical treatment, alternative medicine, as well as nutrition, wellness, and beauty. Medical professionals, therapists, and counselors are in our studio to offer their expert advice on In Good Shape.
And my guest in the studio has not only helped deliver many babies, he's also an expert in keeping mother and child healthy before, during and after birth. Dr. Lars Hellmeier, thank you very much for joining us today.
Thank you very much for the invitation.
Dr. Hellmeier, we've heard about weight gain and that you should try and keep your weight in check during pregnancy. How much weight gain is normal when you're pregnant?
A weight gain of 12 kilograms is normal, but it depends on the body mass index. If the body mass index is high, over 30 for example, you only have a weight gain recommended that is about 8 kilograms.
Mm-hmm. So, you should check your initial weight. If you're very slim, you could gain a little bit more.
Right.
If you're not so slim, you should really watch your weight even more. Well, and
exactly.
It's said that if babies are born with a weight of more than 4,000 grams, that's a problem. Why is that the case?
The mother has probably a gestational diabetes, and the baby is quite big, might be very cute, but it has problems with the glucose. The mother gives glucose from the blood over the placenta, blood sugar over the placenta to the baby, and the baby is used to produce a lot of insulin. And this insulin will keep on when the baby is born, and therefore the level of blood glucose might decrease, and some babies have to stay at the pediatric department and have to get an infusion intravenously, for example, of glucose.
So the baby processes the excess blood sugar of the mom and therefore is actually born with a malfunctioning metabolism. That's the case,
right? And the mother is conditioning the baby to have a diabetes in young years.
Okay, well, so keep your weight in check. Well, one way to do that is to exercise. We've had many women writing in on that topic, wanting to know what sort of things they should consider when they exercise, such as Olga Savchik from Russia. She wanted to know what are the most important do's and don'ts there.
That's very important. You can make all sports you have done before normally, but you only have to avoid competitive sports or martial arts, for example, or all extreme sports. Yes?
So sports where you could actually injure yourself, something like that is to be avoided.
Definitely, yes.
Okay. What about, women who are not overweight? Are they safe from getting gestational diabetes?
No, there are a lot of slender people in the industrial countries who have gestational diabetes as well.